Finally, we'll talk a little bit about a couple of, well, basically just one really, subcutaneous fungal infection. There are, of course, a number of others, but they're not very common in the US. So the species that we'll talk about is Sporothrix shechnii, and it's sometimes called like gardener's disease or rose thorn disease because it is seen in people who work in the garden. You have nodular ulcerative lesions that develop on the lymphatic site that would drain where the initial infection was. So this patient probably had inoculation of the fungus here in the hand, in the finger, and then it spread along the lymphatic draining site. But for the most part, it's not going to spread beyond this. Dissemination is super rare. Like less than 1% of patients will have dissemination beyond that. This fungus is a mold at room temperature and a yeast at body temperature. So that's what it would look like if you tried to culture it at room temperature, and this is if it was cultured at body temperature. In general, the subcutaneous mycoses are sporadic. They're more common in warmer climates. The fungus just does better in the soil. And again, infection is associated with traumatic inoculation, so an injury of contaminated soil or organic matter. So I don't know what it is about armadillos, but armadillos are also associated with leprosy. So armadillo hunters tend to get Sporothrix infections. We don't have armadillos in California, but if you find yourself down in South Texas or something, get my twang going, South Texas, Louisiana, yeah, there's armadillos. So, that's a thought. But also infected cats can have it too. The initial infection may ulcerate, may not. Secondary ulcers will appear 2 weeks or so, and they'll often discharge pus. So that's gross. And they can be diagnosed by culture of the infected pus or infected tissue. The fungus will grow in 2 to 5 days, so it's relatively rapid growing. And it can be treated by oral potassium iodide or azoles. So there's some debate about how exactly potassium iodide works to kill fungi. It's thought that maybe it can cause direct damage and like reactive oxygen species. It's also thought to maybe enhance the immune system a little bit. But potassium iodide is actually listed as an essential drug by the World Health Organization to treat subcutaneous fungal infections, which are very common in other parts of the world. So here we have a case of sporotrichosis after injury with a fish spine. The patient was an 18-year-old male fisherman, resident in a rural area of Sao Paulo in Brazil, who wounded his third left finger on the dorsal spine of a fish that was netted during his work. Subsequently, the area around the injury developed swelling, ulceration, pain, and purulent secretion. It was secreting pus. The primary care physician thought that this was a bacterial infection producing pus and prescribed a 7-day course of oral tetracycline. No improvement was noted, so the therapy was changed to a stronger antibiotic. No improvement noted. 15 days after the accident, the patient had an oozing ulcer and then nodules on the underside of the left hand and arm, kind of moving up along where the lymph nodes would drain. So then the hypothesis changed a little bit to like localized sporotrichosis or leishmaniasis, which we'll talk about in the parasite section, or a type of atypical mycobacterium infection. So there's an actual mycobacterium infection that's associated with water and fish, Mycobacterium marinum, like marine. Histopathological examination of material from the lesion revealed a granulomatous pattern of inflammation. So things like neutrophils and granulocytes were in there, and lots of microabscesses. No acid-fast bacilli or fungal elements were found. However, culture of biopsy material on a specific type of fungal auger grew a mold that had thin hyphae with septa, so it had the separated cells, consistent with Sporothrix schechniae. An intradermal reaction was also positive. Patient was treated with oral potassium iodide with clinical resolution at 2 months of therapy. The clinical presentation in this case actually was typical of sporotrichosis. However, the source of the infection, being a fish spine, was unusual. Generally, we physicians, right, would have suspected Mycobacterium marinum, which is far more common among fishermen and people who deal with like aquaria, things like that. However, sporotrichosis could still be thought of when these workers show lesions that ascend in the pattern of the lymphatic drainage.